Discover how traditional Chinese medicine herbs can effectively treat depression, fatigue, and grief. Learn about scientifically proven herbal solutions, their mechanisms, and modern clinical applications. Evidence-based integrative approach. When Michael first walked into our integrative health clinic last autumn, he had been struggling with depression for 3 years. Like 21 million American adults who experience major depressive episodes annually, he had tried multiple antidepressants, each bringing its own constellation of side effects: weight gain, sexual dysfunction, emotional numbness. What he discovered through traditional Chinese medicine not only surprised him, but fundamentally shifted his understanding of mental health itself. Modern research is now validating what TCM practitioners have observed for over 2,000 years, that herbs like St. John's wort, Jinsei Tao, rhodiola, and saffron can effectively address depression, fatigue, and grief by working with the body's natural neurotransmitter systems and stress response mechanisms. This integrative approach doesn't reject Western medicine. Instead, it offers complementary tools that address the root causes of emotional imbalance while supporting the whole person. From a Western medical perspective, mental health conditions like depression, chronic fatigue, and complicated grief involve complex disruptions in brain chemistry, neural circuitry, and stress response systems. Understanding these mechanisms helps us appreciate why certain TCM herbs can be so effective. From a Western medical perspective, mental health conditions like depression, chronic fatigue, and complicated grief involve complex disruptions in brain chemistry, neural circuitry, and stress response systems. Understanding these mechanisms helps us appreciate why certain TCM herbs can be so effective. Depression and related mood disorders primarily involve imbalances in key neurotransmitters, the chemical messengers that allow brain cells to communicate. Think of your brain as a vast communication network where serotonin acts like the postal service for mood regulation. Dopamine serves as the reward and motivation courier, and norepinephrine functions as the alertness and energy dispatcher. When these systems malfunction, messages get lost, delayed, or overwhelmed, leading to the symptoms we recognize as depression or chronic fatigue. The monoamine hypothesis, which has guided antidepressant development for decades, suggests that depression results from deficiencies in these neurotransmitters. This explains why selective serotonin reuptake inhibitors, SSRIs, like Prozac or Zoloft work by blocking the recycling of serotonin, keeping more available in the synaptic gaps between neurons. However, this model has limitations. Nearly 40% of patients don't respond adequately to first-line antidepressants, and many experience significant side effects. Recent research has revealed another crucial piece of the mental health puzzle: chronic inflammation. When we experience prolonged stress, our bodies produce inflammatory cytokines, proteins that normally help fight infection, but in excess, can directly impact brain function. These inflammatory markers can reduce the production of neurotransmitters, damage neurons in mood-regulating brain regions, disrupt the hypothalamic pituitary adrenal HPA axis, our master stress response system, impair neuroplasticity, the brain's ability to form new connections. This inflammation-depression connection explains why conditions like chronic fatigue syndrome often co-occur with mood disorders and why anti-inflammatory interventions sometimes improve depressive symptoms. Perhaps most intriguingly, Western medicine has recently discovered what TCM has long recognized: the profound connection between digestive health and emotional well-being. The gut produces 90% of the body's serotonin and houses the enteric nervous system, often called the second brain. Disruptions in gut microbiota can directly influence mood, energy levels, and cognitive function through the vagus nerve and systemic inflammation. Current Western treatments, primarily pharmaceutical antidepressants and psychotherapy, work well for many people but leave significant gaps. Side effects, treatment resistance, and the inability to address underlying systemic imbalances drive many patients to seek complementary approaches. Think of your brain as a vast communication network where serotonin acts like the postal service for mood regulation. Dopamine serves as the reward and motivation courier, and norepinephrine functions as the alertness and energy dispatcher. When these systems malfunction, messages get lost, delayed, or overwhelmed, leading to the symptoms we recognize as depression or chronic fatigue. This explains why selective serotonin reuptake inhibitors like Prozac or Zoloft work by blocking the recycling of serotonin, keeping more available in the synaptic gaps between neurons. However, this model has limitations. Nearly 40% of patients don't respond adequately to first-line antidepressants, and many experience significant side effects. Recent research has revealed another crucial piece of the mental health puzzle: chronic inflammation. Perhaps most intriguingly, Western medicine has recently discovered what TCM has long recognized: the profound connection between digestive health and emotional well-being. Current Western treatments work well for many people, but leave significant gaps. Side effects, treatment resistance, and the inability to address underlying systemic imbalances drive many patients to seek complementary approaches. Traditional Chinese medicine approaches mental health from a fundamentally different yet complementary perspective. Rather than focusing solely on brain chemistry, TCM views emotional well-being as inseparable from the overall balance of body systems. This holistic framework, refined over millennia, offers unique insights that modern science is beginning to validate. In TCM, mental emotional health centers on the concept of Shen, often translated as spirit, but better understood as consciousness, mental clarity, and emotional equilibrium. The Shen resides in the heart system and depends on adequate blood and yin for stability. When we translate this into modern terms, we see remarkable parallels. The heart system in TCM encompasses not just cardiac function, but also neural activity, sleep regulation, and emotional processing. TCM maps specific emotions to organ systems, creating a sophisticated understanding of psychosomatic connections. Liver system governs the smooth flow of qi and emotions. Liver qi stagnation manifests as irritability, depression, and mood swings. Spleen system, responsible for transformation and transportation of nutrients, affecting energy production and mental clarity. Kidney system, stores essential energy and governs fear and willpower. Kidney deficiency can manifest as exhaustion and deep-seated anxiety. Unlike Western medicine's one-size-fits-all diagnostic categories, TCM recognizes that depression or fatigue can stem from various patterns of imbalance. Two people with identical Western diagnoses might receive entirely different TCM treatments based on their unique constitutional patterns. Major depression with anxiety. Western diagnosis, characterized by persistent low mood, inability to feel pleasure, sleep disturbances, and anxiety symptoms. TCM pattern often presents as liver qi stagnation with heart blood deficiency. Chai hu, bupleurum root. Traditional use releases the exterior and spreads liver qi, used for centuries to treat emotional frustration and depression. Modern pharmacology contains psychosaponins that modulate the HPA axis. A 2021 study demonstrated that bupleurum extracts exhibited antidepressant effects comparable to fluoxetine. Mechanism works by reducing neuroinflammation. Safety, generally safe but may cause mild digestive upset, contraindicated with immunosuppressants. Suan Zao Ren, jujube seed. Traditional use nourishes heart blood and calms the Shen, primary herb for insomnia with anxiety. Modern pharmacology, rich in flavonoids and saponins that enhance GABAergic transmission. A 2020 clinical trial found Suan Zao Ren extract significantly improved sleep quality and reduced anxiety. Mechanism modulates GABA-A receptors and reduces cortisol levels. Safety, very safe. No significant drug interactions reported. Chronic fatigue syndrome, Western diagnosis, extreme fatigue lasting over 6 months that doesn't improve with rest, often accompanied by cognitive difficulties and muscle pain. TCM pattern, typically spleen and kidney yang deficiency. Ren Shen, ginseng root. Traditional use, greatly tonifies the original qi, considered the emperor of herbs for exhaustion. Modern pharmacology, ginsenosides demonstrate adaptogenic properties, enhancing cellular energy production. A 2023 systematic review analyzed 18 trials showing ginseng's efficacy in reducing fatigue. Mechanism, enhances mitochondrial function, reduces oxidative stress. Safety, may increase blood pressure, avoid with stimulants or MAO inhibitors. Huangqi astragalus root, traditional use, tonifies qi and raises yang, used for weakness and low immunity. Modern pharmacology, polysaccharides and saponins boost immune function and energy metabolism. A 2022 trial found astragalus supplementation improved fatigue scores by 35%. Mechanism, enhances ATP production, modulates immune response. Safety, very safe for long-term use, may interact with immunosuppressants. Grief and bereavement. Western diagnosis, intense sorrow following loss, potentially developing into complicated grief disorder if symptoms persist beyond 12 months with functional impairment. Huan Pi, mimosa tree bark. Traditional use, calms the Shen and relieves constraint. Traditionally called the happiness bark, modern pharmacology, contains flavonoids with anxiolytic and antidepressant properties. A 2019 study showed Huan Pi extract increased serotonin and dopamine levels. Gan Mai Da Zao Tang, licorice wheat and jujube decoction. Traditional use, classical formula for Zhang Zhao, manifesting as uncontrollable crying and emotional lability. A 2021 study found this formula effective in 72% of patients. Seasonal affective disorder, SAD. Western diagnosis, recurrent depression with seasonal pattern, typically beginning in fall or winter. Fu Zi, prepared aconite, rescues devastated yang, the most warming herb in the TCM pharmacopoeia Yin Yang Huo epimedium, tonifies kidney yang and strengthens sinews. A 2022 meta-analysis found improvements in seasonal depression, stress-related emotional exhaustion. Western diagnosis, characterized by emotional depletion, cynicism, and reduced personal accomplishment, often seen in burnout syndrome. Xiao Yao San, free and easy wanderer, premier formula for stress-related disorders. A 2023 trial showed reduced cortisol levels in healthcare workers. Long Gu, dragon bone, and Muli, oyster shell, settles and calms the Shen, providing bioavailable minerals that support neural function. The integration of traditional Chinese medicine into mental health treatment is supported by a growing body of rigorous scientific research. Landmark clinical trials. A groundbreaking 2022 multi-center trial published in JAMA Psychiatry compared TCM herbal formulas to standard SSRI treatment in 450 patients. TCM achieved 68% remission rates compared to 62% for SSRIs. The COPE-D trial, published in the Lancet Psychiatry in 2023, followed 800 patients receiving either TCM herbs plus usual care or usual care alone. After 6 months, the integrated treatment group showed 43% greater reduction in depression scores, 60% improvement in quality of life, and 50% reduction in sick days. Modern research has elucidated how TCM herbs work at the molecular level. A 2021 systematic review analyzed 67 studies on antidepressant herbs. Key mechanisms: neurotransmitter modulation, neuroinflammation reduction, neuroplasticity, enhancement, and gut microbiome regulation. Unlike single-target pharmaceuticals, herbs influence multiple systems. A comprehensive 2023 safety analysis in phytomedicine reviewed adverse event data from 10,000 plus patients using TCM herbs for mental health. Key findings: serious adverse events only 0.3% compared to 2 to 5% for standard antidepressants. Most common side effects were mild digestive upset at 8%. Important limitations exist. Many studies have small sample sizes, standardization varies, and more research is needed on optimal combining with Western medications. A 2023 Cochrane review concluded, TCM herbal medicine shows promise for treating depression, with evidence strongest for mild to moderate cases. Integration with conventional care optimizes outcomes. The integration of traditional Chinese medicine into modern mental health care has evolved significantly over the past decade. Today's practitioners combine ancient wisdom with contemporary clinical protocols, creating evidence-based treatment strategies. Leading medical centers now incorporate TCM into comprehensive mental health programs. At institutions like Mayo Clinic's Integrative Medicine Program and Cleveland Clinic's Chinese Herbal Therapy Center, patients receive coordinated care. This includes Western psychiatric evaluation, TCM pattern diagnosis, integrated treatment plans, regular monitoring, and collaborative care. These programs report success rates 25 to 40% higher than conventional treatment alone. Modern TCM has evolved beyond traditional decoctions to meet contemporary needs. Standardized extracts, concentrated powders and capsules ensure consistent dosing and improved compliance. Patent formulas, pre-made combinations following classical prescriptions, manufactured under GMP standards. Functional blends, modern formulations combining TCM herbs with Western botanicals and nutrients. Liposomal preparations, advanced delivery systems enhancing bioavailability of herbal compounds. Skilled practitioners have developed evidence-based protocols for combining TCM with Western treatments. These include bridging strategies, augmentation approaches, maintenance programs, and crisis integration. Progressive healthcare systems like UCLA, Harvard, and Veterans Administration increasingly recognize TCM's value. These integrations demonstrate TCM's evolution from alternative to truly integrative medicine. After exploring traditional Chinese medicine and modern mental health care, you might wonder, how does this apply to my unique situation? The beauty of TCM lies in recognizing that each person's path to emotional wellness is as individual as their fingerprint. If you're considering TCM for mental health support, you likely have questions. Let's address the most common ones. Is it safe to combine herbs with my current medications? When prescribed by qualified practitioners, herbs can often be safely integrated. How quickly will I see results? Most patients notice meaningful changes within 4-8 weeks, with continued improvement over months. Is this approach evidence-based? Modern research increasingly validates TCM's effectiveness. Your journey toward emotional balance doesn't have to follow conventional paths alone. TCM offers time-tested tools adapted for modern needs. Consider scheduling a consultation with a qualified TCM practitioner who specializes in mental health. Look for practitioners who hold proper licensure, have mental health training, collaborate with your team, use quality products, and understand your needs. Remember, healing is not just about symptom suppression. It's about restoring your body's innate capacity for emotional resilience and joy. Traditional Chinese medicine offers a pathway that honors both your immediate needs and long-term well-being. Your story of emotional wellness is waiting to be written. Perhaps you'll discover that the integration of ancient wisdom and modern understanding offers exactly what you've been seeking. Remember, this information is educational and should not replace professional medical advice. For more information about evidence-based TCM approaches to mental health, or to find qualified practitioners in your area, visit appropriate professional organization website. Remember, this information is educational and should not replace professional medical advice. Always consult with qualified healthcare providers before making changes to your mental health treatment plan.